vouchers for these individuals. So we planned in the Senate to take down all of the monies from the federal government and at the same time provide a voucher system to these working poor.
Why could you not convince your brethren in the House to actually pass a bill that would actually bring health insurance to so many people who need it?
Well, I believe that there are those in the House who fervently believe that the federal government is, headed towards bankruptcy and that they just didn't want to be taking any more money from the federal government. That's what I was told by several
And they couldn't come up with a better excuse than that. That was it.
Well, I think that they're just opposed to that concept and that they believe that this group of individuals are working, that about 70% of them are working, and that they can get their own insurance, I guess.
Linda, it got so contentious at one point in time, the Democrats in the House pretty much staged a protest saying, hey, listen, we're going to have every bill read on the floor to bog things down. Was that really necessary too, though? I think that the Floridians don't like to see those kinds of games being played in the legislature.
Well, it depends on how strongly you feel that there should be 1.2 million people covered. There's only so many tools in the toolbox when you're in the minority. That was one of them. It didn't really, it just was a little frustrating, but most of the bills that were there, all but maybe 8, really actually did get passed. We slowed it down, but that was the only thing that we could do. We were hoping that the slowdown would allow there to be a think-through process that might bring some more discussion about what we needed to do in the House. It didn't. It was probably frustrating for a lot of people, but we had to make a statement as to we've got to deal with this. And I think when you have the governor in support, you had the Senate in support, and then you got to the House, and they just wanted to put, again, our own money and pay for a small group of people, and it's like double taxation, so we certainly weren't going to be for that.
Right, and just so you're wondering, the leadership in the House, local Republican representatives were invited on the show, and all of them declined today. Darren, do you think you're going to see a special session? I mean, think the governor's going to call y'all back?
It's hard to say at this point. He's heading towards re-election and wants to show a more populist tinge to help out. So I could see on that hand, and coupled with the fact that he came out early on supporting it, that he would. But the jury's still out on this, because if there's not an agreement, he's not going to call a special session and fail. We have a compromise Senate plan where we draw down the $51 billion, create 100,000 jobs, and in addition, just subsidize people to buy private insurance. It was a plan that both David and I, or Senator Simmons and I, when we sat on PPACA, approved together. And there are, I believe, some members of the House who would support it, but I think that they felt it's always better to be in the herd down in the House. And so, if we can come up with a general guideline of what it would look like, then the governor would call us back. But if not, he's probably going to have to stay away from it.
Well.